losing their lives to COVID-19. And we're advised to stay at home and stay away from this dangerous virus, while our frontline workers, on the other hand, they are doing the exact opposite, and they are diving into this battlefield and putting themselves and their family at risk. And in the outside view, when we look at these people, they're strong and they're resilient, but what they're going through on a day-to-day basis, it's taking a toll on their mental and emotional health. And first, let's talk about our first responders, Sheriff. Uh, Police officers, firefighters, paramedics, they're all out there to protect and to serve our communities. And right now, they're dealing with a whole lot of changes. How has their jobs and their duties
Thank
changed?
you. That's a great question. When you think about it, their job, the bottom line job has not changed. They still respond to people in distress for a variety of different reasons. Their roles and responsibilities remain unchanged in that regard. The environment that they're going into, however, has changed. When police officers are trained to deal with a threat, generally it's policies, procedures, tactics, training, all of that that leads up to something that is tangible, something that you can see. And this is not that. This is something that is out there and is a threat to you, but you don't have the ability to be able to manage it in the same way. We're used to training for fires, floods, unrest, mudslides, earthquakes, major events like that, where they have an initial uh, incident occur. We respond to that. We identify what the scale of that is, what the scope of it is, and what we need to do with that. And then we bring in the necessary resources to appropriately deal with the situation. We act on that, we stabilize the situation, and then we go into the recovery phase. This has been different because we continue to do the job that we do every day, but on top of that is this overlay as well. First responders, they understand the danger that they go into every day out there in the field, and they willingly do that. But they don't do it with an eye towards exposing themselves to something that they're likely to bring home to their family, to kids, to other relatives, and to those parents, grandparents who are vulnerable more so to this virus where it could potentially be fatal.
Just
And
recently,
that's
I heard about a 5-year-old child who is a daughter of paramedics and first responders, and she ended up getting COVID-19 and dying from that.
right.
You know, as a first responder, when you hear stories like that and you
Right.
go out and do your job, I mean, that's got to mess with your mind a lot. I mean, how does that impact our first responders, and how does it, that mental state, and how does that impact the way they do their job?
So it does weigh on you. Everything you have in life is focused on that child, in this case, or your parents, or whoever your loved ones are. And for you to go to work and deal with what you have to deal with there, knowing that you're going to potentially bring home something that could be fatal to one of your relatives, it does weigh on the mind, more so than I think the trauma that you see on a daily basis under normal circumstances, where you deal with it, you compartmentalize it for the most part, and then you go home and you try and deal different, separately with your personal life. When you believe that you're bringing something home that potentially is harmful or fatal to those you love, that's an extra burden that you're going to be carrying around for the duration.
Right. And also, when you think about it, you know, anyone who has a tough job, you know, being a first responder or even a medical worker, after a long days of work and a stressful day, you want to go home and see your family and give them hugs. And that kind of, you know, gets you
Mhm.
back up. But now a lot of people can't even do that because they're afraid of giving something that they may have to
Yeah.
their loved ones.
Yeah. Yeah. No, I think it's very unique. A lot of the things we do to comfort each other are taboo now during this period, because of the potential of spreading an infection to others. So it has been an adjustment, not only for first responders, but for people across the board, throughout our society. And when we think of something happening, an earthquake, a fire, a flood, or something, it's very localized for the most part. Even an earthquake, which is a larger scale, will be localized to a particular region. When you look at this, nothing like this has happened in our lifetime to this degree, where we've seen a pandemic spread across the world that impacts literally everywhere. Doctors, nurses, police, firefighters, paramedics. They're all people who are trained to do the business of rescuing others, helping others. That's what they do day in and day out. And so they don't generally think of themselves as somebody who needs to be rescued. But the reality is, in an environment like we're dealing with, by virtue of the fact that they're helping others, they're susceptible to getting sick as well. And they then become those in need of help. And physically, we see what happens. We've seen many of our frontline medical personnel in particular, exhaustion, their immune systems are weakened, and ultimately they get sick. And you know, my hat's off to the work that's been done in the past couple of months, because it's really everybody pulling together to be able to try and get past this. Um, but when you think about the expectations that we have for those that are the first responders, sometimes you would look at them and you think that, you know, that's not realistic. People are not going to do that. But first responders, in their mind, push themselves harder than the public might ordinarily do, and they go past the point of where they're exhausted, where they're susceptible more so than they otherwise would be. And so, from a mental health standpoint, uh, there's a need there to debrief. There's a need there to talk to others about what we're going through.
The
And
caregiver burnout, which is already there for people that are on the front lines. When you see something so horrific and you can't go home to tell your family about it, that already is a distancing kind of a profession. So you already have the propensity to have caregiver burnout. And then on top of that, you have the vicarious trauma. So maybe I myself saw something at work today, even if I didn't have to handle it firsthand, and that might have left an impact on my emotional well-being. And then another thing that is kind of unique is moral injury. In the face of asking questions about not just, will I get sick if I handle this patient, will my family members get sick, but what if I am left with compromised because I have to reuse my protective gear? Or what if I don't have any of this? Like we've seen some nurses that suffer from moral injury when they try and put their foot down and say, I cannot work in these conditions, which is a complete opposite from the oath that we take to save as many lives as we can. Part of moral injury could also be being the one that gets to decide who lives. So when they're sitting there calculating, well, this person will have 5 more years left on a good day, and this person has 25 more years just based on certain demographic factors. And most people, when they go into helping professions, go in to help everyone that they can, not trying to distinguish between who deserves more resources. So all of those kind of things, in addition to being a regular member of society, trying to cope as best as we can with the pandemic, is an extra layer of stress.
Treated many medical workers that are currently serving on the front lines. When you talk with these people, you know, what are the things that they're going through, and how is that impacting their mental health?
Because you want to believe in your company on a good day, but especially during times of the unknown. A completely separate person that I was speaking to is on the front lines of a major health maintenance organization in Southern California, or in the nation. And they talk about the confusion between the federal guidelines versus the guidelines that of the organization that they're operating in. And so when you are already in a very stressful environment where you're expected to produce at a certain volume, and then on top of it, you're questioning whether or not you have the right resources, it just adds a complete other layer. So there's a lot of moral injury, not just related to, will I get sick, will my family get sick, and can I care for these patients adequately, but do I feel protected enough to feel good about doing my job?
More questions. One of the reasons why I thought it was so important for us to have this conversation today and talk about our medical workers and our first responders is because I talked briefly about this with the sheriff as well this morning, is that, you know, everyone at some point in their life, they go through this very difficult stage. Right. And with our medical workers and our first responders, they have, you know, in a way, it's easier access for them to get to that planning stage because law enforcement officers have weapons, and medical workers, they have potentially lethal medications. They have access to those. So that's one of the reasons why I thought it was so important for us to talk about this today.
I look at where we are today. I started in the business almost 40 years ago, where it was taboo to seek out mental health treatment for anybody in the first responder field. They were worried about the stigma that was attached to that, and would they ever get over that? Would they be looked upon as being weak and not able to do the job? And that was really, the beginning of police psychologists, and they were breaking into the field. And in the 40 years since that time, we have come a tremendously long way toward acceptance of seeking help when you need it. But we still have a long way to go. As I mentioned earlier, police officers, first responders, doctors, nurses, they see themselves, our self-image is one of helping others. We don't need help, we help. And so to be able to get past that is a big step. But I think once we accept that and others accept it around us, that there's going to be that need, then I think we're in a much better place.
Our Asian American families, especially, people don't really talk as much about mental health issues. Does that make it more difficult for them to seek help?
And just to be able to talk about it with somebody who's not going to be judgmental, somebody who's going to try and help you put it in perspective so that as you move forward, you do so in a much more healthy way. I think there is a cultural component there. I think we need to talk about that, but we need to help each other to be able to get past that as well.
An added layer, if you're a frontline worker and you're Asian American, because this has happened not just here in the States, but even in other parts of the world, where someone's trying to go to work as a frontline medical worker and they're being called something racist, and then they have to roll up their sleeves and act like a hero. So it's a very complicated feeling of being despised by society and blamed while also trying to be part of the solution. Is that there's this age-old challenge of trying to overcome stigma. There's a huge body of research that talks about how stigma prevents Asian Americans from seeking services until much, much later than all other ethnicities. So as an example, if someone has depression and they're part of majority culture, they'll probably present shortly after someone says, you need help. But for Asian Americans, they might suffer in silence for a very long time until they've exhausted all their other possibilities. The cultural barriers are things like, if I go and seek services, this might prevent my family from being able to hold their head up high in society. So the fear of losing face is very complicated and will actually prevent people from seeking services, not just for mental health. A few mental health resources that people may or may not have access to. So I'm saying this knowing that people are in a variety of different work settings where some of these are not accessible. But as of first, I would try and see if my supervisor can be a bit of an anchor for me. And if not, then I would see if they can organize some sort of a debrief or a consultation team for me or for other folks that might be affected. So that's kind of similar to what Sheriff McDonnell was talking about, like having some way of debriefing. So I know that my normal reaction to an abnormal situation is okay. And then if not, just seeking your own consultation with either other team members or people in related professions. And then hopefully you belong to an organization that has an employee assistance program. Those employee assistance programs should all be hooked up with language facilitators. So I know places that I used to work at, we would hire a third-party vendor to even be patched to the phone if we had to. And then if you're working as a frontline worker, hopefully you have some sort of commercial insurance benefit. And then each one of those are supposed to have updated panels. They're not all perfectly updated all the time. But when you go into search for a provider under a commercial insurance website, you should be able to click on settings like other languages or ethnicity of the provider. And otherwise, starting out at county mental health is a great place to go. A lot of them actually do have workers that can speak other languages, and even if they can't take on the case themselves because the person doesn't have documentation to get services through the county, they can also serve as a triage center and hopefully refer you to the right services.
there's resources for the individual employee assistance programs. There's psychological services within most police departments now, and fire departments and other first responder entities, as well as Dr. Fu talked about, then your own health plan and the ability to be able to seek out somebody outside of the workplace altogether that you might feel more comfortable in dealing with that. And those are available then to family members who are covered under that insurance policy as well. And then if you're not in that kind of a position, then you need to reach out to the county and to be able to see what's available there. Or as she mentioned as well, there are some doctors that will take on pro bono work that do a tremendous job. Particularly in a time like this. Dr. Fu talked earlier about othering, looking at yourself as different from someone else. And some of the rhetoric we've heard around this crisis has caused some on the margins to act out in ways that are unhealthy or potentially, injurious to some members of our public. So I think the key here is the police will do whatever they can to be able to help protect all of our communities, but they have to know what's going on. And I think, like we talked about earlier, maybe a hesitance to get help on the part of some communities is also, demonstrated in the fact that they don't seek help for things that happen in their community as well. They're hesitant to call the police. They're hesitant to say, "I have a problem. Can you help me?" Really, the communication part of it is they don't want to be viewed as complainers. I think the key is to have relationships, informal relationships as well, between the community and our police agencies. And community policing is all about that. And so to be able to call someone up and say, "Hey, I've got this community that doesn't feel safe because of," and maybe it's an individual, maybe it's a group, or maybe it's a perception. But to be able to talk about those things in a way that you put it all on the table, and if there's a problem that's focused on an individual, allow them to be able to deal with that person. That person may be in need of help themselves, mental health or otherwise. And so I think communication, like in so many cases, is key in this. It's not that the police don't want to help in any situation. I would say it's that they're not aware of the need for that help.
Because as
Or
I
the
mentioned, it
desire.
doesn't matter what age you are. It also doesn't matter what Asian you are, or even if you're not Asian, if you appear Asian. So just having an awareness that this could happen to you. So in order to do that, get to know your neighbors, um, being aware that people know I live here. If you see any suspicious activity, you're welcome to call my behalf. And if you'd like, I can do that on your behalf as well. And then that being said, being aware of suspicious activities. So setting things up where you feel safer at home. Unfortunately. So when you're in the moment, maybe there's tons of people watching what's happening to you. And you might be thinking, how come no one's doing anything? Just simply pointing to someone saying, you call 911, and you call the store manager right now. This is unacceptable. Makes it a little bit more likely that someone will actually step up and rise to
Her question is, even though the number of cases and deaths continue to rise, there are parts of this country, as you guys all know, that are reopening, like Georgia and Texas. They're slowly reopening their businesses, which could possibly extend the virus's influence here in the US. In what way could this factor into the mounting stress that first responders are currently feeling?
It's kind of trying to strike the balance between life and livelihood, and that's not an easy one. People are strapped. Many people unemployed, unable to care for their families the way that they need to, and so there's a sense of urgency to get back to work. And if they feel that the risk is low to them and their family, then that sense is exacerbated by the fact that their frustration that they're not allowed to go back to work. For those that are out in areas and they're putting themselves in harm's way by getting close together unnecessarily, I think there's a level of irresponsibility there. But I think that where people are trying to get out, it's we can't generalize and say that it's right or wrong. I think it depends, and you have to listen to the individual cases. There are some certainly legitimate concerns to get back to work and get America going again. But at the same time, we want to do so as safely as we can, because as we've dealt with this crisis from the beginning, the goal was to be able to not have the healthcare system be overwhelmed at one point, but rather to be able to stretch that curve out over a longer period. So to that, we need to look at the models put together by the professionals to be able to know how long are the wearing of the masks appropriate, how long is the social distancing appropriate, is there going to be a new normal based on what we're being told by medical professionals. A lot of unanswered questions, and I think it's trying to strike that balance that's a responsible balance between getting back to work, being able to provide for our family, and at the same time doing so in a safe way where we don't endanger other people in doing that.
And it's very important that we talk about this. So thank you guys so much for coming out and to help us get that message across.